So in heart surgery, when I'm trying to restart the heart, and remember the heart's like a chicken breast that you're taking out of your freezer. It's no longer really even alive when you've done these things to it. And then you have to restart it. You take your hands and you feel it. And I'm not trying to say it's a prayer that you say, but there's something mystical about holding someone's heart in your hand, someone who trusts you, and their family's outside waiting for what happens. And you take it and you massage it back and you reperfuse it with blood, and as that warm blood gushes through the arteries, the life-sustaining oxygen begins to perfuse these tissues, the heart comes back alive again. That's not just a pump being turned back on. There's more that's happening. And the energy behind that experience, especially when you do a heart transplant, is something that is very difficult to explain as a Western-trained doctor, but it's hard to deny if you've been there. And I think very often it's the experiential side of the equation that's not in our textbooks, that takes doctors from being technicians to clinicians, takes us from being scientists, which the word physician would describe us as, physics, right, the Greek base, to doctors, teachers, doctore, and then we practice medicine, which is the healing art of what we're given by our teachers. I think more and more we're appreciating that although science can give us a lot, and it can make it possible for us to save lives that are otherwise going to be lost, it's not the panacea that we had hoped it might be. And as we begin to run into more and more boundaries that limit the ability of traditional academic medicine and the science approach to healing to provide those solutions, we have to look further in areas where science has not yet gone. Now, in fairness, in my opinion, the more we can integrate medicine, the more we can bring new ways of thinking about healing into the vernacular, the more we can expand the boundaries of traditional medicine. As an example, take energy medicine. So here's a field that doesn't exist for Western-trained doctors like myself, because we can't measure energy. I can't tell if you got it or if you don't have it. I can't tell if I changed it. But we've done a lot of research now looking at the fact that energy probably does exist in some form. I mean, in fairness, life is defined by energy, right? A cell is alive because it can keep the energy on the inside of the membrane different from the energy on the outside of the membrane. So it's not a far stretch to begin to imagine if you put those cells together into organs, they'd have energy. You put those organs into bodies, that body would have an energy. And so we are now challenged with the reality we can't measure it, but it's probably there. And if we could expand our vistas, take down those blinders that we have, and begin to use these tools to better the care of everyone undergoing any procedure, I think it offers a solution that everyone will be happy with. And what's happening, I think, in Western-based medicine is that we're beginning to become a little less dogmatic, a little more comfortable being uncomfortable with the reality that we don't get